What causes diabetes? Diabetes is a chronic metabolic disorder that affects how the body regulates blood sugar, glucose, levels. There are two main types of diabetes, type 1 diabetes and type 2 diabetes. Here are the primary causes of each type. Type 1 diabetes. Type 1 diabetes is an autoimmune condition where the immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. The exact cause of this autoimmune response is not fully understood, but it is believed to involve a combination of genetic and environmental factors. It is not considered to be directly caused by lifestyle or diet. Type 1 diabetes typically develops early in life, often during childhood or adolescence, and requires lifelong insulin therapy for blood sugar regulation. Type 2 diabetes. Type 2 diabetes is the most common form of diabetes, accounting for the majority of cases. It occurs when the body becomes resistant to the effects of insulin or doesn't produce enough insulin to maintain normal blood sugar levels. Several factors contribute to the development of type 2 diabetes, including genetic factors. There is a genetic predisposition to developing type 2 diabetes, meaning that having a family history of the condition increases the risk. However, specific genes and their interactions are still being studied. Obesity and excess weight. Being overweight or obese significantly increases the risk of developing type 2 diabetes. Excess body fat, particularly around the abdomen, can lead to insulin resistance and impaired glucose metabolism. Sedentary lifestyle. Lack of physical activity and a sedentary lifestyle contribute to the development of insulin resistance and obesity, both of which are risk factors for type 2 diabetes. Unhealthy diet. Consuming a diet high in processed foods, sugary beverages, refined carbohydrates, and saturated fats increases the risk of developing type 2 diabetes. A diet low in fruits, vegetables, and fiber is associated with an increased risk as well. Age. The risk of type 2 diabetes increases with age, particularly after the age of 45. This may be due to factors such as decreased physical activity, muscle mass, and impaired glucose regulation. Ethnicity. Some ethnic groups, including African Americans, Hispanic/Latino Americans, Native Americans, and Asian Americans, have a higher risk of developing type 2 diabetes. Gestational diabetes. Women who have had gestational diabetes during pregnancy are at an increased risk of developing type 2 diabetes later in life. Additionally, their children may also have a higher risk of developing the condition. It's important to note that while these factors contribute to the development of type 2 diabetes, not everyone who has these risk factors will develop the condition. Additionally, other forms of diabetes, such as gestational diabetes and rare genetic forms, have different causes and risk factors. Managing diabetes involves blood sugar monitoring, healthy eating, regular physical activity, medication, such as insulin or oral medications, and, in some cases, weight management. It is essential for individuals with diabetes to work closely with healthcare professionals to develop an individualized treatment plan and lifestyle modifications to maintain stable blood sugar levels and prevent complications.